So today we are going to start a new topic in biochemistry. We are going to discuss about vitamins, yes, or vitamins as you want to speak it up. So vitamins, as the name suggests, vita means essential, essential for life, something you need to survive. Yes, so vitamins are nothing else but biomolecules that our body cannot synthesize. એક એવા molecule જે body બનાવી નથી શકતી, and because of that we always have to take them from external sources. આપણે બહારથી અંદર લેવું પડે. So if you already will be knowing the classification and the names A, D, E, K that are water soluble and B and C which are fat soluble. So accordingly you will be knowing the basic things, but we'll be seeing about how they are synthesized in the body, that is metabolized in the body, through which route they are entering and where they are going. Also what is being transported. Yes, we now know enzymes, they are responsible for transportation. Enzymes responsible છે transport કરવા માટે ઘણા બધા molecules ને blood માં. And also we are taking these vitamins from outside. આપણે બહારથી vitamins લઈ છીએ. Yes, so that means they need to pass through the whole digestive tract. એ digestive tract માં pass થશે, and from there we will be able to metabolize them. Yes, so it will go to liver. Liver માં ઘણા બધા enzymes work કરશે અને convert કરશે in active form, and active form આપણે બધા cells body ના utilize કરશે. Vitamins are needed for so many things. May that be your normal vision, may that be your normal skin condition, your normal growth, all the things. In every aspect vitamins are necessary. That is why the deficiency causes specific diseases. જો vitamins તમે regularly નહીં લ્યો, every week or every day, if you don't take specific vitamins, that means your body will be deficit. તમારા બોડીમાં vitamins નહીં હોય, એના લીધે there will be disease. Yes, એ disease કયા રીતે કયા નામથી આવશે, that also we are going to see. Yes, so we'll start with the objectives of understanding. First is introduction, what are vitamins. Second, characteristics and functions of vitamin. Then we are going to see the classification, structures of each and every individual vitamin, individual characteristics of vitamin. We are also going to discuss from which dietary source you are going to obtain vitamins. શેમાંથી તમને specific A vitamin જોઈ છે તો શેમાંથી આવશે, D vitamin જોઈ છે શેમાંથી આવશે, B complex આખું જોઈ છે શેમાંથી આવશે. That all things we are going to discuss. Mechanism of action, much more important from our point of view. Yes, biochemistry માં આ જ સમજવાનું છે, mechanism of action, કે આપણે diet માં અંદર લઈ લીધું. Now what is the process, which are the enzymes, which are the routes through which the protein and the enzymes will be acting on the vitamin, and through that we will be trying to observe, obtain, as well as circulate the vitamin. And last, individual functions. Yes, in the body, what metabolic function does this possess? So all things will be discussing. So going to introduction, the word vitamin comes from the Latin word vita. Vita means life, essential for life, something that is very essential for life. Vitamins are organic components in food that are needed in very small amounts for growth and for maintaining good health. So vitamins, they are needed in small health. It is not કે આપણે regularly 1 to 2 grams every day. Carbohydrates, fat, proteins જેટલું આપણે લઈ છી એટલું content આપણે vitamins નું નહીં લઈ, but they are still needed even in the small amount. Everybody must eat a certain amount of vitamins to stay healthy. Yes, if you don't eat vitamins, if you are not eating the dietary supplements that we are going to talk about for each vitamin, that means your body will be deficit for that vitamin, and there will be diseases because of that specific vitamin, deficient vitamin. Vitamins are chemicals found in very small amount in many different foods. Yes, it is not કે vitamin A ખાલી meat માંથી મળશે. There are other sources also. Yes, it is not exclusive to any one food. આપણે બધા sources માંથી, may that be vegetarian or non-vegetarian, both the sources will contain some amount of vitamins, and that are essential to maintain normal health. So this is the main introduction. Characteristics. If we say something, okay, this is chemical is vitamin, what are the characteristics? Yes, so vitamins are required in small quantities in the diet because they cannot be synthesized by the body. So important first point. These are the substances that are not synthesized by the body. So koi પણ carbohydrate હોય એને તમે કયો that this is a vitamin, it is not done. Yes, why? Because you are taking it very big amount, as well as carbohydrates are being able to produce synthesized by the body from other nutrient substances. Say for example, directly proteins માંથી પણ carbohydrates form થાય, fat માંથી પણ carbohydrate form થશે. Yes, so here it is not a characteristic, but vitamins, they are not synthesized at all. You have to take it from outside food. Second, water soluble vitamins cannot be stored in human tissues. Their excess is excreted with urine. Yes, so we are going to see the classification, and you already know, we already described fat soluble and water soluble. So water soluble will not remain in the body. Yes, they will be washed out. That is why their deficiency is much more common. Any deficiency સૌથી વધારે હશે water soluble vitamins ની compared to fat soluble vitamins. Significant amount of fat soluble vitamins can be stored in adipose tissue and the liver. Yes, so as the name suggests, fat soluble vitamins, so along with fat, along with the adipose tissue, એ આરામથી સ્ટોર થઈ જશે બોડીમાં. એક્સેસિવ અમાઉન્ટ હશે તો પણ સ્ટોર થશે. Yes, so any deficiency બહુ rarely થશે, but for water soluble vitamins, they will be excreted immediately in the urine by the kidneys. Yes, so their deficiency is much more common. Synthetic vitamins are identical to natural vitamins. Yes, now say for example, you go for checking of vitamin B12, tamaru B12 ઓછું આવ્યું. Yes, so what will the doctor suggest? They will give you dietary supplements કે તમે આ વધારે ખાઓ. Yes, if you are taking non-vegetarian food, eat this, eat green leafy vegetables. Yes, specifically they will tell you, but also they will prescribe you tablets. Yes, so tablets શું છે? They are synthetic vitamins. We are synthesizing, we are making them artificially, but they have the same role as natural vitamins. Our body does not differentiate between a natural vitamin and a synthetic vitamin. Yes, so vitamins can also be synthesized, they are also replaceable. Yes, we can take directly medication B12 na 500 mg directly you can ingest, yes, in form of a tablet. Once growth and development are completed, vitamins remain essential nutrients for healthy maintenance of the cell, tissues and organs. Yes, it is not that vitamins only are needed for organ or tissue growth. Yes, growth time e jarur pade vitamins ni, evu nathi. It is needed even to maintain a healthy cell. Healthy cell hase to healthy tissue hase, healthy tissue hase to healthy organs hase. Yes, so overall healthy body will be formed. So growth and development માં ખાલી vitamins ની જરૂર ન હોય. Every day we require even to maintain a healthy body. So that is the main characteristics of a vitamin. Function. હવે function જોઈએ, vitamins શું બધા પ્રોસેસમાં help કરે છે. તો vitamins are helpful for the healthy life of body in the following respect. They build up resistance of the body against diseases. Yes, we are going to see various vitamins which will be responsible for immunity. Yes, example vitamin D only. Today itself we'll be trying to cover A and D. So in D also, we know it is a vitamin formed from the sunlight. It is also termed as sunshine vitamin, but it also has a role for bones as well as immunity. Yes, so immunity પણ e help કરશે. Yes, it helps acts as cytokines. So cytokines are the cells which fight against infection. So our immunity is enhanced. Prevent and cure various diseases caused by deficiency. Yes, જો vitamins તમે regular લેશો તો એના લીધે જે diseases થાય એના deficiency થી નહીં થાય, and so you are maintaining your body into normal state. That is the second function. Third, it helps the digestion and utilization of mineral salts and carbohydrates in the body. Yes, many vitamins, as we are going to describe, will have, along with them there will be absorption of various minerals. Yes, vitamin D absorbed thase from the food, or vitamin A absorbed thase from the food. Along with this, magnesium, calcium, other things will also get absorbed. Vitamin D is utmost needed for the digestion or absorption of calcium. Yes, so calcium તમે excessively લેતા હોય, tablets પણ લેતા હોય, તમારા બોડીમાં vitamin D ના હોય તો એ absorb નહીં થાય. Yes, so vitamin D also helps in absorption and digestion of calcium. Yes, that is essential for your bones and even muscles. So help in digestion and utilization of mineral salts and carbohydrates in the body. Even for carbohydrates it is needed. Stimulate and give strength to digestive and nervous system. Yes, all the vitamins, specifically vitamin B complex, as we are going to see, has function to protect as well as help in their function of digestive system and nervous system. Yes, તો તમે digestive system and nervous system નું જે covering છે and normal function ચાલુ રાખવા માટે conduction in nervous system, that is impulse એમાંથી travel થાય, as well as for digestive system જે peristalsis movement છે એની માટે vitamins are essential. If vitamins are not there, there will be abnormal sensations and there can be diarrhea or constipation depending on if there is deficiency of a specific vitamin or not. It helps in health protection, as we described, directly related to immunity, and help maintenance of proper health and normal growth. So growth is also one of the factors. Some vitamins are essential for growth specifically, and some other will be maintaining your proper normal health. Yes, so which are the vitamins, how they are, we are going to see depending on the classification. So on the basis of the solubility, vitamins are of mainly two types, fat soluble and water soluble. So fat soluble, as you already will be knowing, A, D, E and K, and water soluble will be vitamin B and vitamin C. Vitamin B again is a complex comprising of many other vitamins. It is further divided into three. We are going to see which are they when we are going to see vitamin B complex in detail. But first we'll like to describe fat soluble vitamins, later water soluble, and first after this we are going to see the differences. What is the main difference of fat soluble and water soluble? Fat soluble, as the name itself suggests, fat ma soluble થઈ જશે. Soluble means mixed થઈ જશે. Yes, so vitamins that dissolve in fat. Because fat is easily stored in our body, fat soluble vitamins can be stored within our fat. એટલે adipose tissue જ્યાં પણ હશે, specifically liver માં fat વધારે સ્ટોર થાય, ત્યાં આ vitamins excess હોય, તમે excessively લેતા હશો તો એ સ્ટોર થઈ રાખશે. Yes, so their deficiency is much more less common compared to water soluble vitamins. Why? Because water soluble easily, water આપણે regularly pass through the micturition process, urine form થાય, એમાં vitamins નીકળી જશે, excess હશે તો. This means they can accumulate and saved for later use. The fat soluble vitamins are A, D, E and K. Water soluble vitamins. Yes, vitamins that dissolve in water, as the name itself suggests. Because our body is a watery environment, these vitamins can move through any body part easily. Yes, so say for example, if any part of the body, say for example your muscles, muscles of the forearm require vitamin B and require vitamin C, they are water soluble, they can pass easily. Fat soluble are selectively permeable. Yes, in our proteins hase cellular membrane upar. Yes, we have talked about the fats and also the proteins and enzymes. So in our enzymes hase surface of the membrane ma to e bind thase and under jase, baki it is not allowed to enter. But water soluble vitamins can easily go in any cell. These vitamins can move through the body pretty easily, and they also have to be flushed out by the kidney. So advantage છે with water soluble vitamins નો કે ગમે તે સેલ માં easily enter કરી શકે, ગમે ત્યાંથી નીકળી શકે. But also it can be easily excreted through the kidneys, whereas fat soluble vitamins easily excrete નહીં થાય kidneys માંથી. Yeah. Water soluble vitamins include the B complex vitamin and vitamin C. Only two, vitamin B complex and vitamin C. Now vitamin B again is divided into B1, B2, B3, B5, B6, B7, B9 and B12. Furthermore divided into 8 to 9 subtypes. Yes. Which are they? What is their name? Everything we'll be discussing later on when we are going to discuss vitamin B complex in detail, because each and every vitamin has its own function. બધા જ vitamin આપણે discuss કરી છે, A, D, E, K, 8 vitamins of B and B complex and 1 C. So total 12 to 13 vitamins we are going to study, and all of this have their specific role. બધાનું એક individual role છે. Yes, અને એવું પણ છે કે ઘણા vitamins બીજા vitamin ઉપર dependent છે. How? We are going to see in further classes. So these are the water soluble and fat soluble vitamins, A, D, E, K. Fat soluble, as we already have termed them. If you can remember the name right now, because individually you have to remember the name. Vitamin A, also termed as retinol. Retinol. Vitamin D, cholecalciferol. Yes, I hope everyone already knows this to an extent. Vitamin K, menaquinone or piloquinone. Vitamin E, tocopherol. Yes, tocopherol. Water soluble vitamin, first talking about the here will be non-B complex, that is vitamin C, ascorbic acid. Vitamin C, ascorbic acid. B complex is again divided into B1, B2, B3, biotin, prothenic acid, folic acid, B12, pyridoxine, pyridoxal, and pyridoxamine. Yes, so we are going to see them in detail one by one. B1 is also termed as thiamine, B2 is also termed as riboflavin, B3 is niacin, biotin, prothenic acid, folic acid, vitamin B12, pyridoxine, pyridoxal, and pyridoxyamine. As the name itself suggests, the structure will be very similar for B12 and B6, but the amount of or the group attached to them will be only different. So, which are the differences of between the water soluble and fat soluble? આ બંને વચ્ચે difference શું છે? So, absorption. First, water soluble directly blood માં વયા જશે. Yes, but fat soluble have to pass through the lymph via the cellular metabolism. એટલે કે પહેલા digest થશે, પછી metabolize થશે, transport થશે liver માં cellular metabolism થશે, and after that only they can be transported. Yes, water soluble, water directly can be absorbed in the blood, and with that these vitamins will already be in the blood. Yes, so if I want to say absorption, it will be very fast for water soluble. Absorb બહુ જલ્દી થઈ જશે. Yes, compared to fat soluble vitamins. Why? Because this have to pass through a process, cellular metabolism process in the liver. After this it will be transported to lymph, but અહીંયા directly blood માં વયા જશે vitamins, so it will be very fast to transport. Transport is free. Yes, they can move easily because they are in the water formation, and here they will require a carrier. So always fat soluble vitamins છે A, D, E, K. Yes, they will always require a carrier. તો જ્યારે પણ આપણે એક એકનું મેટાબોલિઝમ સર્ચ કરતા હશું, મેટાબોલિઝમ આપણે સ્ટડી કરતા હશું, at that time we will have to remember which are their carriers in the blood. પ્લાઝમામાં કયા પ્રોટીન સાથે ઈ બાઇન્ડ થશે, and dependent on that they will be moved from one portion of the body to another through the blood. Storage, they are circulating freely. Yes, આપણે જે વાત કરી, they are easily present in the blood, but that is also their negative કે easily move કરી શકે છે બધે, તો કિડની માંથી જલ્દી નીકળી પણ જશે along with water. Yes, fat soluble vitamins, as we described, these are in cells with the fat, specifically adipose tissue in the liver. ત્યાં જ સૌથી વધારે સ્ટોર થશે. Excretion, they are directly excreted in the urine, and fat soluble vitamins, they are stored with fat and also excreted in form with the fats only. Toxicity, possible with supplements, likely with supplements. So possible, that is water soluble vitamins છે તમે excessively લેશો, vitamin B regularly, say for example B1 you have to take 20 microgram per day. Yes, so just an example, 20 microgram per day લેવાનું છે અને તમે 2 grams લેવા માંડો, that means you are taking 100 times more. Yes, તો possible છે કે એના લીધે side effects આવે, પણ that will be temporary. Why? Because that will be completely excreted within hours or 1 or 2 days by the kidneys. Kidneys directly excrete કરી દેશે જે પણ excessive amount છે, it is readily excreted. Yes, so it is possible with excessive amount of supplement. Food માંથી કોઈ દિવસ toxicity નહીં થાય, but toxicity for fat soluble vitamin is likely. Yes, તમે excessive amount of vitamin A or vitamin D consume કરવા માંડો, it will be stored for more and more time. તો એ વધારે ટાઈમ સુધી બોડીમાં રહેશે, તો એના લીધે ટોક્સિસિટી થઈ શકે. ટોક્સિસિટીઝ એના લીધે એક્સેસિવ જો બોડીમાં થઈ જાય, તો there are side effects of it. Yes, so that is possible for water soluble. એટલે બની શકે કે within hours or days the patient will become normal. But fat soluble vitamin, if there is toxicity, excessive amount in the body, it is likely only with supplements you can have such a toxicity, but it will remain for long period of time. Yes, so A, D, E, K toxicity is much more common compared to vitamin B complex and C. Requirement, water soluble vitamins you need to take every 2 to 3 days. Yes, every 2 to 3 days each and every water soluble vitamin B complex, akhu and C you have to take. Fat soluble vitamins every week in small amount if taken, that is fine. So ADEK not so much to be consumed per day. Yes, its requirement is very less. Why? Because it is already excessively stored in the body. So for that reason every week is also done for fat soluble vitamins. These are the chemical structures of vitamins. Yes, vitamins are essential nutrients that our body needs in small amount. More specifically, organic compound is defined as a vitamin when it is required by an organism but not synthesized by that organism in the required amount or at all. There are 13 recognized vitamins. Yes, as we described, and we are going to study each and every one in detail. Yes, If you can remember, you have to remember the structures, but it is essential that you at least know the name of all the vitamins. Okay, first we are going to describe about vitamin A, retinol. Yes, there are other forms of vitamins also. Now understand, જ્યારે પણ આપણે vitamin A કહીએ or vitamin D કહીએ, vitamin E કહીએ, yes, say for example vitamin A we are saying it retinol, vitamin D we are saying as cholecalciferol, but it is always કોઈક precursor માંથી develop થયા હશે. Yes, precursor means other types or other forms of that vitamin જેમાંથી active form છે retinol. Yes, active form ને આપણે એક વિટામિન નું નામ આપ્યું છે, but when we ingest it, when we are taking from outside food, that may be in other forms and it needs to be converted to the active form in the body through enzymes, through the metabolic processes. એટલે કે say for example you are ingesting retinal or retinoic acid, yes, directly from the food, directly from the carrots you are obtaining retinal. retinal body માં અંદર આવી જશે, absorb થઈ જશે, store પણ થઈ ગયું હશે. when it is to be used, the retinol માં convert થશે. Yes, and then only it will perform its function. So retinol is a precursor. Precursor means something that is before the actual vitamin that we require. Yes, so vitamin A is a group of unsaturated nutritional organic compounds. Unsaturated nutritional organic compounds, CHO group, yes, mainly, which includes retinol, retinoic acid, and several provitamin, that is precursor, any pelana. Carotenoids among the beta carotene is more important. Its active form is present only in animal tissue. Yes, so whenever you are taking it from plants, yes, vitamin A, carrots and everything, you are mainly ingesting carotenoids and specifically beta carotene. Beta carotene under avse, it will be converted to active form, that is retinol, or retinoic acid. આ ત્રણેયને સાથે પણ vitamin A કહેવાય છે. Yes. Daily requirement: men and women require 600 micrograms. Pregnancy and lactating women will require 950 micrograms. Increased amount of vitamin is required for proper growth. Yes, we are going to see the functions also. Infants will require 350 and children will require again, similar to men and women, 600 microgram of vitamin A. Yes, so this is normal prescription. Yes, retinol, retinoic acid, all the three are active forms of vitamin A, mainly when we are obtaining from vegetarian food. Yes, not taking directly non-vegetarian food. At that time you are ingesting carotenoids, which is provitamin. Yes, that is precursor before the active form, specifically beta carotene. These terms that are highlighted you need to remember. Yes, retinol, retinoic acid and beta carotene, they need to be ingested, પછી જ તમે એને યુઝ કરી શકશો અને કન્વર્ટ કરી શકશો એક્ટિવ ફોર્મમાં. active form directly will be serving the purpose of its function. So these are the dietary sources. Yes, carrots, papaya, meat, fish, mango, sweet potato, egg and cheese, pepper, avocado, melon, peach, broccoli, squash and apricots. Yes, so these are the main sources. Now here you can see the highest amount of vitamin A will be present. Most of the vitamins will be present in fish. Yes, the structure of fish is as such and it is an another animal. So in animal ma e vitamins nathi, nutrients che, they are directly synthesizing these parts. Yes, fish che ema e vitamin nathi, એમાંથી આપણે લેશું એટલે વિટામિન છે. યસ, વિટામિન મીન્સ વોટ, જે વસ્તુ આપણે સિન્થેસાઇઝ આપણા બોડીમાં બનાવી નથી શકતા, સિન્થેસાઇઝ નથી કરી શકતા, but fish is able to. So it is not a vitamin for fish, it is vitamin for us. So when we are consuming such items, meat and fish specifically, we are getting excessive amount of vitamin A. Also other items, as you can see, they are also present in vegetarian food also, it is present. Yes, it is not as such that you need to eat non-vegetarian food, then only you will consume or have enough amount of vitamin A, but it is present excessively in these amounts in meat and fish, along with even eggs and cheese. Yeah. Metabolic actions of vitamin A. So dietary retinyl esters are hydrolyzed by pancreas or intestine hydrolysis in intestine, releasing retinol and free fatty acid. એટલે કે આપણે જે ingest કર્યું છે dietary retinyl esters, yes, dietary retinal esters. Esters, classification of lipids. Lipids when hydrolyzed give form to glycerol and three free fatty acids. So glycerol અહીંયા કયું છે? Retinol and fatty acids. Yes. Enzyme responsible, that is pancreatic or intestinal hydrolysis. Yes, important terms. See, whenever we are discussing metabolic activities of vitamin A or any vitamin in short, I would suggest you to keep at least a book with you, write the process, write the enzyme, and write the formation. Yes, આમાંથી આ form થયો, આમાંથી આ form થયો. Yes, it will be a continuous cycle. એક cycle form થશે and it will be easy for you to understand, to remember also. So પહેલા તો તમે dietary retinal ester બહારથી લીધા. Yes, say for example you took it from cheese. Yes, excessive amount of cheese you had, from that vitamin got ingested in the body. Ingest થયા, pancreas માં ગયા અને intestine માં ગયા, directly from absorption. By that directly digestion and absorption na લીધે pancreas and intestinal hydrolysis. Yes, through the process of hydrolysis, this is the enzyme in intestine releases retinol and free fatty acid. એમાંથી retinol અને free fatty acid બનશે. Carotenes, yes, beta carotene specifically we talked about. Yes, vegetarian food માં સૌથી વધારે હશે. Carotenes are hydrolyzed by beta carotene 1515 dihydroxygenase. Yes, so 1515 if you don't remember that is fine. Beta carotene dioxygenase of intestinal cells, so પાછો intestine માં, to release 2 moles of retinol which is reduced to retinol. Yes, enzyme will be reductase, as the name itself of the process. જે process માં help કરે એનું નામ ASE. Yes, so reductase will be responsible to reduce retinol into retinol. In intestinal mucosal cells, intestine માં, retinol is re-esterified to LCFA. So LCFA is nothing but low carbon fatty acids. Low carbon fatty acids incorporated into chylomicrons and transferred to lymph, as we described. Most of the time શું થશે કે digestion થશે, absorption થશે, પછી vitamin જે પણ છે it will be transferred to mainly lymph, અને lymph through બધે આખા body માં circulate થશે. Yeah, so in intestine mucosal cells specifically, retinol re-esterified, yes, OH group will be added to LCFA, incorporated into chylomicrons and transferred to lymph. So the structure that is formed, that is termed as chylomicrons. Retinol esters of chylomicrons are taken up by liver and stored. Yes, excessive amount જે પણ હશે એ liver માં જશે અને store થતું જશે. When required, vitamin A is released from liver as free retinol. Directly stored થશે in the form of chylomicrons and it will be released in form of free retinol. Yes, જ્યારે પણ જરૂર હશે body માં, blood માં ખબર પડશે. Who will sense it? Your hypothalamus specifically senses all the vital signs. Yes, so blood માં કોઈ પણ index ઓછું થઈ જાય, blood pressure ઓછું થઈ જાય, blood માં plasma વધી જાય, any vitamin is deficient, any water is deficient, or even food is deficient, carbohydrate, fat, anything, તમને ભૂખ લાગે, that is all function sensed by your hypothalamus. Hypothalamus કહેશે, liver ને signal આપશે કે now it is time, vitamin A decrease થઈ ગયું છે, you release it from the your storage, so it will release as free retinol. Now retinol, as we described, koi pan hase fat soluble, they will always need a transportation. Yes, so retinol is transported in circulation by plasma retinol binding protein. Plasma retinol binding protein, or PRBP, plasma retinol binding protein, as the name itself suggests, in association with albumin. Yes, albumin, that is mainly the fat content. Retinol RBP, retinol binding protein complex, binds to specific receptors on cell membrane of peripheral tissue and enters the cell. Again, fat soluble vitamins માટે અંદર જો જવું હોય તો they require specific proteins. If proteins નહીં હોય outside, then it is not possible for them to move in. Yes, water soluble vitamins easily બધેથી જઈ શકશે, but fat soluble they require specific proteins, તો જ અંદર જશે. Yes, so રેટિનોલ અને જે રેટિનોલ બાઇન્ડિંગ પ્રોટીન છે એનું કોમ્બિનેશન ત્યાં પહોંચશે સેલ પાસે જ્યાં જરૂર છે વિટામિન એ ની, ત્યાં બારે ઈ સેલમાં ઓલરેડી એક પ્રોટીન હશે જે બાઇન્ડ થશે એની સાથે, તો જ ઈ એન્ટર થઈ શકશે, બાકી એન્ટર નહીં થાય. Carry retinol by cellular retinol binding protein, that is CRBP, and cellular retinolic acid binding protein to a nucleus and binds to the chromatin. Yes, directly એકવાર સેલમાં enter થઈ ગયા પછી પણ vitamin A has its function that we are going to see now after this. So for that also it might need to transfer to the DNA also. Yes, if you don't remember the last line, that is fine. That is cellular retinol binding protein and cellular retinolic acid binding protein. These are both the proteins present within the nucleus. That for that એક nucleus માં પણ door હશે, you can say, that will be opened by these proteins, and this proteins will be this vitamin will transfer to the DNA for specific purpose. Coming to rhodopsin, which is an important structure for your vision. Yes, if rhodopsin is not there, then your vision will be altered, and that is one of the main function of vitamin A. So rhodopsin is the membrane protein in photoreceptors of retina. Yes, retina, the structure of the eye. Yes, if you remember physiology, retina forms the photoreceptors. Photoreceptors means any upper light પડશે તો જ તમને vision આવશે. Yes, optic nerve only senses signal from this retina. એની ઉપર light પડશે retina ઉપર અને optic nerve એમાંથી signal બનાવીને brain ને મોકલશે and you will be able to see. But anima, you need at least one this structure rhodopsin, then only retina becomes photoreceptors. જો rhodopsin નહીં હોય તો photoreceptor sensitivity જે હોય, low light sensitivity જે હશે specifically, that will be altered. And alter થઈ જશે, that means તમારી vision blur થઈ જશે, decrease થઈ જશે, or that can also be blindness. Yes, so if you remember the process, that is much more important. It will be advisable if you remember. So rhodopsin in presence of light is converted to bathorodopsin. Bathorodopsin is converted to lumirodopsin, that is lumi as light. Lumirodopsin is converted to metarodopsin, metarodopsin 1, metarodopsin 2. It will be converted to scotopsin, and scotopsin can again be converted to rhodopsin. Yes, so this is the whole metabolism process in which vitamin A plays a very important and vital role. So the functions, what is the function of vitamin A? Plays a role in variety of function throughout the body, such as first is vision. Yes, as we talked about, rhodopsin na synthesis માટે it is essential. એ નહીં હોય તો તમારું vision alter થઈ જશે. Second, gene transcription, as we described here. Yes, the last metabolic activity of vitamin A. Yes, so it is transferred to DNA. DNA માં transfer થશે, that is genetic materially alter કરી શકે. So for that reason, gene transcription is an important process done by vitamin A. Gene transcription એની માટે કરવાનું, નવા proteins form થાય એની માટે. Yes, it is type of a signal that the DNA gives. Okay, now this protein is required. We describe the process. Yes, in protein, introduction to protein. Immune function also, it plays an immune function as acting as an antioxidant activity. Yes, excessive amount of oxygen, specifically O minus, if formed in the body, that damages many cells. Yes, so that is being neutralized by vitamin A, and hence it plays an immune function. Embryonic development and reproduction, for both the function it is essential to have enough amount of vitamin A. Bone metabolism, yes, along with vitamin D and vitamin A, both together will form a bone metabolism cycle that will be regulated by both vitamins. Hematopoiesis, that is production of blood cell and platelets. Yes, specifically hematopoiesis, you might have heard erythrocyte sedimentation rate. Yes, so formation of new RBCs, that also requires vitamin A. Also platelet formation, RBC, WBC, platelets આ બધું જ bone marrow માંથી form કરવા માટે vitamin A is necessary. Skin and cellular health. Yes, so it also plays a role to maintain normal skin and also to maintain normal cellular health. Now you can write, just giving you a tip, skin, not skin but cellular health, immune function in almost all vitamins. They will have, to an extent, all the vitamins, may that be fat soluble or water soluble, they will have some effect on immune system of the body and cellular health. Yes, because vitamins આપણે વાત કરી કે normally શું કામ લઈએ છીએ આપણે, excessive amount માં લઈ લઈએ તો વાંધો છે, but if why are we taking that on regular basis? Because they are not produced in the body. And why are they essential? In normally આપણી body health normal રાખશે. Yes, in the introduction part we saw, okay, growth પણ થઈ જાય તો પણ એને normal રાખવા માટે they are essential. So all the vitamins, these are the two important terms you will be encountering every vitamin in. Yes, okay, fine, we'll not move forward. We'll discuss about vitamin D, E, K and B and C complex, B complex and C in the upcoming lectures. Okay. Any doubts till now? Any vitamin you didn't get, anything you didn't get from introduction, from classification, from characteristics of vitamins, from production and vitamin A whole? Any doubts? Yes or no? Everyone in the chat.
Sir, I have one question.
Yeah, sure, please.
Why is it is that sublingual is more effective?
Sorry, why?
Sublingual is more effective and its process is fast. Why so?
Yeah, not see, this is also part of pharmacology, but I'll still describe. Whenever you take medication by oral route, yes, so by oral route you are taking, so that has to pass through first your mouth, then to the esophagus, it moves down to stomach. In stomach it will be digested, in intestine it will be absorbed. From absorption it will first move to liver for metabolism. એમાં થોડોક content decrease છે. So say for example you are taking 1 milligram, yes, so after digestion, after absorption and liver metabolism, it will remain 250 grams in the blood. Absorb thase je main e 250 grams રહેશે. Yes. On the contrary, if you take drug directly sublingually, yes, directly it will be absorbed from the mouth only, and here liver is bypassed. So liver માં જે metabolism થવાનું હતું એ directly bypass થઈ જશે. Yes. So for that reason it is more absorbed. But it is essential to understand not all drugs which are sublingual, not all drugs can be taken sublingual. Yes, say for example a drug B complex itself, it is if you have taken, I am not sure if you have taken, I took it very recently, so I know it is બહુ જ કડવી હોય, any smell બહુ જ ખરાબ હોય, you try to keep it, you will vomit it out. Yes, also absorption of such from the you can say mucosa of the mouth is not possible. બધા જ drugs absorb ના થાય. Yes, so only specific drugs, say for example vitamin C ascorbic acid, it is very easily absorbed through the mouth, so you do not need to ingest it. તો ingest કરશો તો તમે વધારે કન્ટેન્ટ લઈને બોડીને પણ હાર્મ કરો છો, લિવરને હાર્મ કરો છો, અને તમારા બોડીમાં ઇફેક્ટ ઓછી આવે છે. બટ કમ્પેર ટુ sublingual, it is sublingually if you take, it is much more easy to absorb, and if preferable, if the mucosa inner lining of your mouth is able to take it, it is much more safer also. But again, not all drugs can be taken sublingual. Yes, that is main point.
Okay, sir. Thank you.
Yes, any other doubts anyone has? You will be learning the routes of administration, may that be in the form of oral if you take, may that be sublingual, may that be subdermatomal, IV, anything, IM, intramuscular, intravenous, all these things. But you will be studying them in the pharmacological part. Yeah. Okay, no doubts, no doubts. Okay, fine. So we'll keep it till here. In the next lecture, we'll move forward with completing, not completing, I guess we'll need still 2 or 3 more lectures for vitamins, and then we'll move forward to metabolism, carbohydrate metabolism, fat metabolism, and protein metabolism. Yeah. Okay. Ayush, have you taken the attendance?
Yes, sir.
Okay, fine. So we'll conclude here. Again, we are meeting in say 20 minutes, and we'll be starting with exercise therapy. We'll be completing stretching today itself. Yeah. Okay. Hope you have a good day. Be safe.